dear colleagues, friends, ladies and gentlemen, I feel honored to be with you today and to talk about Naqa, a window to pure life. And by the way, our name Naqa means pure. It's from purity, and that's what we are trying to help people. So Naqa means purity. And secondly, I would like to start by saying in the Kingdom of Saudi Arabia, like many parts of the world, we have a big problem of smoking. I know this great bank, Saudi French bank, has got a tremendous work that has been done, and they are encouraging people to live in a very healthy environment. And I have seen this commitment today, not only through our partnership with you, but also from what I have heard from the top management today. In fact, I was very much impressed, and I had few things to learn from the presentation that was presented a while ago. So first of all, what is Naqa? Naqa was established by the late Minister of Health, Dr. Ghazi Al-Qusaybi, some 30 years back in around 1986, and it started as a department that belongs to Ministry of Health in the Kingdom of Saudi Arabia. Later it was shifted to Ministry of Labor and Social Affairs. And when it was later, the two ministries were separated, Ministry of Labor and into two ministries, Ministry of Labor and Ministry of Social Affairs. We went to report to Ministry of Social Affairs like all charitable organization. It went into dormancy for some years, then it started to be active again, and we managed to get Naqa running, and we attracted several projects, fortunately, by our partners and donors. Our goals actually in Naqa are only 4 simple goals, but they are big for us, they are big for our capabilities. First of all, as an NGO aspiring to motivate, to succeed, and keeping in mind limited resources, Naqa has the following goals. First of all, to increasing the community awareness about the dangers of tobacco products. The second objective or goal is to help smokers and other tobacco product users to quit using the best possible approaches to help them quit. Third is to campaign for the laws that will minimize the impact of smoking, or to eliminate or reduces the dangers of tobacco products on the society. Finally, to conduct some studies to delineate the nature of tobacco catastrophe in the Kingdom of Saudi Arabia. Well, did we succeed or not? We have some sources of success. First of all, we have a committed board that sees the danger of tobacco products on the society, and they are working hard to send that message. We have a society in the kingdom that has values that could be utilized to help Naqa in its mission. One of those, for example, that until now it's considered in certain communities as a taboo to smoke, especially for females. And also charities and donors and partners that share the feel of urgency to act against smoking, and a government that tries to protect its citizens and residents from the dangers of smoking. And finally, a history of success in achieving goals, even with the limited resources that Naqa has. And let's just give a few examples of what we have achieved so far with the help of our partners and donors. We have 2 major projects that has been going on for some time. We had a long-standing project for almost 10 years. We are in the 9th year with Sheikh Sulaiman Al-Rajhi charitable organization. They supported us over the 10 years with a budget amounting to 37 million riyals. according to the programs that we are doing. In the late 4 or 5 years, we have shifted gear towards going into school children and to educate them about the dangers of smoking. And then we had another quality project with Sheikh Al-Rajhi, Salih Al-Rajhi Endowment, and this is trying to affect or impact the youth through unorthodox methods and to increase their awareness about the dangers of smoking using mobile stages, cartoons, and some activities, competitions, etc. Also, there are some banks and major donors and supporters. They have supported us, and we are glad to be here today, and we are honored to be with one of the banks with whom we have done some work and we achieved some results. And finally, we are working in NAQA as an umbrella for all societies that are concerned with tobacco problem in Saudi Arabia. We have done several meetings with these, and we work as the secretariat for that group of societies that are working on NAQA. Recently we have finished a meeting, 2 meetings, one in Riyadh, one in Jeddah, and our next meeting will be moving to Unaiza in coming January. Okay, how to deal with our partners? We have a full coordination with tobacco control program that belongs to Ministry of Health. Although we have more ability and more flexibility in moving compared to the government bureaucratic machinery, but we coordinate with them fully. We have an open mind to corporates, whoever can subscribe to our cause and share our vision and goals, even partially. We have a respect for all the values and principles of other partners who work with us. Also, we conduct our projects in the highest standards that are possible to us, considering the resources that we have. And we act always and work in honesty and transparency in all our dealings with any work that we are doing. And finally, we have the desire to learn from both our successes and our failures, and we never, ever are shy to admit our mistakes. Well, it's interesting to look into the history of tobacco and how we got into what we are in, the situation that we are in today. It was not known in the old world, Europe, before Columbus discovered North America, or the 2 Americas, and it was used by Native American inhabitants for religious ceremonies. And the Europeans took it back with them, and it was studied and as an active ingredient, and was given the name of nicotine. The active ingredient that is available or that is present in tobacco leaves was given the name of nicotine by the discoverer. And it was rejected by the church at that time, church leaders. In fact, whoever dared to smoke of the religious and church people was stripped of his title and rights as a church leader. And even in the Ottoman Caliphate, the caliphs banned its use in the whole empire, the Ottoman Empire. However, that resistance could not be done very easily. This is one of the old depictions of tobacco in the South American Maya culture, and this is one of the old forms of smoked tobacco. In fact, the Native Americans or indigenous population of America used to use a very long pipe. It's about 2-3 meters, and they blow in it. Accidentally, somebody just inhaled instead of exhaling, and he discovered that it produced some effect. This is one of the old farms. It shows how they were using people to dry it, to prepare it for. This is some of the leaves of tobacco, and this is the oldest machine that started the mass production of cigarettes. It was in the late 19th century, and this is one of the earliest campaigns against smoking. It shows how bad it is for health. This is the distribution of smoking all over the world. You see, we have a problem here. We have a problem in some parts of United States and some South America, but this is the Southeast Asia, a very big consumers for tobacco, unfortunately. This is the consumption. You can see that this part of the world almost consumes 50% of the world production, while 1/4 is in Europe. These are some, it's a bit slow. This is some of the, production, I mean the prices of cigarettes in the different parts of the world. In the Kingdom of Saudi Arabia, we are unfortunate that we are amongst the least expensive and the cheapest cigarettes. If you see, compared to 45, 40, 50 riyals, 46 riyals, this is in dollars, you can, most of the countries, they are much higher than Saudi Arabia. Even if you look like to a country like, for example, Indonesia, where the price of the packet of cigarette is around $1.50, about 5 riyals, relatively speaking, it's more expensive in Indonesia than it is in Saudi Arabia. And this is really very dangerous, and we have to, this is the production of tobacco leaf in tons. You see, China is possibly producing more than 3 or 4 countries of the following countries altogether. And this is cigarette top production countries. Of course, China is at the top again, and the Netherlands is the lowest. These are the revenue for some of the major companies, the 6 major companies, and you can imagine one of the companies gets out of their sales a revenue of almost 100 billion a year, while the least of the 6 is producing something like 25 billion. Again, we are amongst the country that gives the lowest taxes to cigarettes, and that's one of the sources of our problem. You see, some countries are as high as almost 65%, 63%, while other countries are in the order of 40%, while in Saudi Arabia is much less than that. There has been, why I'm showing you those figures and bothering you, because I know in the bank you are working with numbers the whole day, so you don't need somebody to tell you more figures. But I'm saying this because in adult smoking, this is the prices of cigarettes in United States over the years, and this is the rate of smoking in United States. And it's very clear here that the higher the price of cigarettes, the lower the rate of smoking. And if we are thinking that the picture for children is different, this is exactly the same figures, but this is for children smoking. This is the prices of cigarettes, and this is children smoking. When the prices were low, it was a higher rate of smoking amongst children. Once the prices started to increase, the rate of smoking go along. This is in one century, the production and consumption of cigarette has 100 times increase in a short period. This is the sources. Actually, this is news from the 15th of October this year. There is a meeting for the parties to the FCTC, which controls the trade of tobacco. and their meeting they said that tobacco prices will have to increase in order to curtail its impact. And we are campaigning with the government of Saudi Arabia and also with the Gulf region to get the prices a little bit increased so we can protect some of our youth and adults. The insight of our excellent speaker about 20 years difference or delay in between cancer and smoking in males and females is depicted in this slide, and it shows that people who are saying, I'm very healthy, I've been smoking for 5 years or 10 years, so what's the heck, I will continue smoking. Possibly it will come during a late time. And I'm really impressed with the amount of knowledge that I've received and input in the previous presentation. Professor Richard Dole, who did a study for 50 years on the GPs in the UK, he calculated they are all GPs, they have good health record, they eat very well, they have very good income, and they are aware of the evils and dangers of smoking. He calculated that an average doctor, he compared smoking doctors and non-smoking doctors, will lose of his life between 10 and 15 years on average. And who of us is willing to give 20 years of his life? I shouldn't keep you long. I want to conclude that we are trying our best, and our best is through our partners. We cannot work alone, and we appreciate our cooperation. We can help each other in a win-win approach. Corporations and cooperation and mutual understanding can go a very long way. You have been very receptive, very cooperative, and very understanding, and for that we are very grateful, and thank you very much.